Hi, I'm Julie Cerrone. I'm a Bethel Park resident, and for years I tried to find a solution to my knee problem. I have psoriatic arthritis and I have avascular necrosis, which means part of my femur bone actually died. Went to all the top doctors in the tri-state area, and really no one could offer me any help until I found the Regenexx procedure. And these stem cell procedures, these platelets procedures, they're being done right here in Pittsburgh, and they're transforming lives. It's kind of like I had a religious experience. I feel like I need to tell everybody and anybody about it, because when I was looking for a solution, no one told me about it. So if I could offer you any advice, it would be to know your options. Don't just take what your doctor says as Bible. Go out there, do your research. There are so many different alternatives to just a joint replacement, to surgery, and stem cells is one of those amazing options.
And what I'd like to add is don't let the insurance stop you. We went to many doctors, multiple opinions. A lot of them just wanted her to walk on crutches for another 10 years before she was a candidate for a knee replacement. Your life is so important. The time that you can spend at 30 years old, no, you're not going to spend the next 10 years on crutches.
Right.
So if it gets you to the point where you have to maybe forego a vacation. I know a lot of people that will spend what it costs to get your life back with this procedure on one vacation. Take that retirement money out and use it. Use your own stem cells to heal your body.
Yes.
It's amazing.
Welcome everybody, thanks for coming out today. My name's Dr. Jesse Sally. Today I'm going to be talking to you about how we as physicians are utilizing your body's own natural healing potentials, including platelets and stem cells, to actually help your body re-heal on its own. So who are we? I'm with a group called Rehabilitation and Pain Specialists. We're based out of the greater Pittsburgh area. We have 4 different locations that sort of all surround the city. It's myself, and then my partners, Dr. Mark Adelsheimer and Dr. Paul Lieber. We are also accompanied by our 2 physician's assistants. On the left, Melissa Aaron, and on the right, Sarah Rowling, who also assists us in the care of these procedures. We have 4 convenient locations around the city. To the north, we have our RIDC Park location. We also have Bridgeville more to the south, Monroeville to the east, and Sewickley to the west. I personally am seeing patients at the Fox Chapel location, Monroeville, and the Bridgeville areas. So who do we treat? Really everybody. Anybody in this room is really a good candidate for what we would consider stem cell treatments. Now that's variable to some degree, but it's everybody. Weekend warriors, the active elderly, professional athletes, anywhere from young athletes, traumatically injured folks, really anybody and everybody. So, if you think, oh, this isn't for me, I'm too old, any excuse that you could think of, come and see us. It's probably not the case. So the overview sort of this talk is I'm going to sort of give you a background on what Regenexx is. I'm going to talk to you a little bit about the different kind of treatments that we do, including prolotherapy, platelet-rich plasma, platelet lysate, the stem cells, and then we'll sort of walk through what a typical stem cell treatment entails and what you can expect. So minimal downtime. Our patients are back to their daily routines usually within a couple days. I'd say the most that we're usually having people not doing their normal daily function is about 2 to 3 days. back to work much quicker. Like I said, everybody is sort of a little bit different, but for the most part, within a week, people are usually back doing what they need to do without issues. And back to leisure activities much quicker. Walking, golf, anything that people would want to do, going to the grocery store, if that was a limitation for you, going to the mall. A lot of people find that they return to that very quickly. So this is a biologic model. Myself as a DO, the osteopathic philosophy sort of encompasses how the body itself has its own intrinsic healing capability. And we're shifting our focus to how do we optimize the body's own ability to regenerate these sort of structures that inherently are breaking down. Common treatment areas that we normally focus on, obvious areas: shoulder, elbows, hips, knees, ankle, foot, and spine, all of your typical orthopedic types of areas. But it gets much more focused than that as well. Wrists, hands, thumbs, pretty much anything and everything, as long as it's musculoskeletal or bone related, we can treat in some fashion. So there's different types of regenerative treatments. So the four main areas are prolotherapy, platelet-rich plasma, and platelet lysate, which sort of fall under the same umbrella, and I'll explain that, and then your stem cells. Prolotherapy, a little bit more focused on ligament and tendon type injuries. Platelet-rich plasma, also very good for tendon and ligament injuries, maybe even a little more advanced. Platelet lysate we sort of reserve for the spine, and I'll sort of go into why that's the case. And then the stem cells really good for anything joint or tendon or really spine related. Prolotherapy, what is it? It's actually a procedure that's been around since the 1930s, so it's old. It's been around for a while. People have been using prolotherapy for longer than this stem cell procedure has been around. So it's a solution of dextrose, anesthetic, and basically saline. It's sugar water, more or less. But there's no steroid involved with it. So what it does is you inject this into affected ligaments, tendons, even into joints themselves, and you're basically sort of spurring the body's inflammatory process, and you're reinitiating that body's self-healing mechanism. And you often get these long-term permanent pain-relieving results because the body focuses on that inflammation, and it institutes that rehealing process, and you get better. So people that benefit from prolotherapy, hypermobility syndrome is one thing that we use prolotherapy for very often. I just had a guy this morning who was in the clinic, young athlete who dislocated his shoulder, had a lot of instability, couldn't throw, and I did one prolotherapy treatment on him 2 weeks ago. He came back today. He was 50% better. He's going back to school in Florida, and he's going to follow up with us intermittently. So, it's even within a couple weeks, people are already seeing benefit even from, drastic injuries. Things like Facet syndrome, we use this a lot in the back to treat sort of instability around the areas of the spine that are unstable. Chronic strains and sprains, tendinopathies, that kind of thing, ligament injuries. I had prolotherapy personally for an MCL tear that I suffered, and I did very well. I was back in a couple weeks. Chronic tendinopathies, like I said, and even osteoarthritis. So, mild to moderate osteoarthritis in the knees, we have done prolotherapy with pretty good success. So, again, so prolotherapy is a little bit separate because that's sort of that's not really the intrinsic factor that we sort of focus on. So that's a little more non-self related. But when we're talking about using our own blood products, that's when we get into the platelets and the stem cell model, and we can talk more about this. Platelets, obviously found in the blood. They contain most of the body's healing and growth components. They help to speed tissue repair, and they contain actual serotonin release that reduces pain actually when you do get injured. So the platelets are what come in, when you have an injury, say you cut your arm, you form the scab releases platelets, the platelets go out, they cause inflammation, That calls everything from the body in, all the macrophages that clean everything up, all the inflammatory factors, and then you get tissue remodeling, the stem cells come in, and that's where you get the tissue regrowth and repair, and then everything goes back to normal. And obviously the complete healing is the optimal response. So platelet-rich plasma, usually better for things like joints, tendons, ligament, cartilage issues. Moderate osteoarthritis is usually very responsive to the platelet procedures. And the nice thing about the way we do this is we can concentrate our platelets to the patient's needs. So when you're talking about PRP, where physicians are basically just using the bedside centrifuge, it's sort of a one-size-fits-all. You take blood, they put it in the centrifuge, it spins, you get whatever you get out of it, and they can get different volumes, but the concentration is usually about the same, somewhere between 5 and 7 times. We can go anywhere from 5 times to 20 times. So we have a large variability in how we can treat people. With the growth factors in the platelet injections, it's released slowly. So you can consider a platelet sort of like almost like a capsule. Like if you take a pill, it's in a gel cap, it goes into the stomach, it releases the medicine slowly, and then that's how you get the effect. Platelets are sort of like that capsule. When we're talking about the platelet lysate, we basically just take the platelet and we remove the capsule. So basically we're just releasing all that intrinsic growth factor from the platelet itself. And the nice thing about the platelet lysate is we can use that for more spine-related procedures where we would replace things like epidural injections where people would normally get steroids. We institute the platelet lysate for actual healing response around nerves, into discs, annular tears, all these sorts of things. And it's great for treatments of radiculopathy, nerve entrapments, stenosis, all these types of issues. And the growth factors, like I said before, are immediately available because they don't have to be released by that platelet housing anymore. This is sort of what I was alluding to earlier. We're not the typical bedside centrifuge. We have our own biologic lab where we actually, have the platelets and we can use them and concentrate them in the form that we need to. And we're not a weekend course. This isn't something that we learned to do at a conference, over the course of the last couple of days. This is something that we've been trained in over the course of years. We've gone to Colorado and trained with the guys that have been doing this for a long time. And, both ourselves and our technicians who work in the lab, they're very well versed in how they're going to do this. So no bedside centrifuge, no weekend courses. Like I said before, we have our own Class 5 biologic cabinet in the office. So everything that happens when you go in, it never leaves the house. So we're not sending it out to some other laboratory to get processed and then it comes back. Everything happens right in there within a couple hours. So one of the big differences that you can definitely see between the Regenexx SCP product, or the super concentrated platelets, versus your standard platelet-rich plasma that comes out of the bedside centrifuge is, it's pretty obvious. You have a lot of red here, and basically all that extra red is red blood cell product, and it's ancillary. It's not really necessary for the actual treatment. But when you take that red product out and you're left with just strictly concentrated platelets, it looks like that straw-colored orange, very clear color. So basically we take all that extra unnecessary product and eliminate it, and that's where we actually get a better, cleaner, more effective product. Like I said, variable differences in how much we can concentrate the platelets, anywhere from 5 to 20 times that you'll get, 5 that you'll get from the usual bedside, and then whatever we need for anything and everything that we treat otherwise. This is sort of what I alluded to with the use of the platelet lysate. A lot of people, when they go to pain practitioners for back pain or neck pain, they're doing these different types of procedures where they're injecting steroids into the epidural space or whatever it may be. Steroid in itself is not a benign medication. Steroid can cause tissue degeneration, it can cause bone degeneration, demineralization. Actually, recent studies have shown that injecting steroid into the spine or into the epidural space even once increases your fracture risk by about 30%. So, people that have very fragile bones, over time that becomes a real risk, and you can actually have secondary injuries as a result. So with this, there's no steroid side effects. We basically take that negative response and we eliminate it. It's just the positive healing response that you get from the procedure. And it's regenerative, it's not degenerative, so we're actually giving back to you, not taken away. It's not just a mask for that, for the inflammation, it actually does that healing response. So this is a graph that sort of shows the difference between the Regenex platelet lysate versus your traditional steroid epidural injection. So you can see at the 3-month mark, the amount of pain relief that you get from, or actually say the functional rating or how people tend to function after these steroid injections. This is what you would see from your normal steroid epidural. This is sort of the functional level that you see after the platelet lysate injections. And you can see this falls off very quickly at the 6-month mark, whereas with the regenerative procedure, there's still a very high level of function that's maintained even into that 6-month mark. So you get a little bit of a dip, but it's much longer acting than these typical epidural steroid injections. So just to sort of recap that a little bit, prolotherapy, like I said, dextrose, anesthetic, saline, platelet-rich plasma, extracting your platelets, concentrating them, giving them back to you. Platelet lysate, more for the spine, basically just eliminating that platelet shell and giving that back. So platelets and stem cells work synergistically. So we'll get into a little bit of how the stem cells work in terms of how we use them and why we like them. So what's a stem cell? Adult stem cells are an undifferentiated cell. It's held in reserve in the bone marrow until it's needed. Like I said, when the platelets go in and there's a need for it, everything comes into the blood supply, goes to where it needs to go, and that's when you get the response. It can turn into all sorts of different types of cells. It can orchestrate a repair response, and it has self-renewal capabilities. So if we take them out, they regrow, they regenerate. So it's an ongoing process. They also are useful to help provide new blood supplies, which is inherent for any type of healing response. You got to have blood to help the tissue heal. So how does the Regenex model sort of stack up to everything else? A lot of people are touting many different types of ways that these stem cells can be administered and how they sort of are treating people. They have these same-day fat stem cell treatments, embryonic stem cell treatments, and then there's something called Regenokine, which not a lot of people are very familiar with, mostly offered in Germany. So I don't know how many of you guys are going to Germany, but that's something that you might want to look at. The common thing is, doesn't fat have much more stem cells than bone marrow? Well, no. There are actually 10 to 20 times more stem cells per unit volume in the bone marrow concentrate that we take out than there are with the fat stem cell procedures. So way more there. In the head-to-head comparison, the orthopedic conditions heavily favor the bone marrow treatments for positive responses. So, we've kind of taken the fat aspect of it and said, nah, we can get more stem cells and we can get better responses. So, plus the SD Plus procedure that we're using now gets about 20 times the amount of stem cells that you get than you can from most of the bedside centrifuges that the fat uses. The amniotic stem cells. Now, this is sort of a big topic of controversy. There are a lot of people that are offering these third-party amniotic stem cell injections. There's actually never been a study that's been put together that says or shows that these amniotic injections actually contain any viable active stem cells. Just amniotic tissue from the birth sacs and the birth membrane. So we're not dealing with live stem cells. We're dealing with sort of freeze and thaw and processed amniotic sacs. And there's no good data that actually says that this works better in comparison to stem cell treatments or even in its own isolation. So the baby juice sales pitch, doctors are offering it, and I don't necessarily know if it's something that would even be beneficial. So that's my take on that. So Germany, like I said, offering the Regenokine treatment. Basically, this is just a serum-based anti-inflammatory shot. It's used in U.S. veterans, particularly people that are stationed overseas, and something that definitely repeated, and that's basically all it is. So the common treatment areas that we focus on for stem cells, very similar to the platelet and the prolotherapy treatments. All your common joints, shoulders, elbows, hips, knees, ankles, and spine. Plus, like I said, anything and everything else that may be ailing you. Shoulders, we'll start there. Rotator cuff injuries, partial thickness tears, and even full thickness tears up to 1.5 centimeters of separation respond very well to the stem cell treatments. The people that get greater than 50% improvement is about 80% of the patients that we treat. And I would say commonly for partial thickness tears and even full thickness tears, it's on the high end of that. For labral tears, where the actual chalk block of the shoulder starts to deteriorate, again, people that are experiencing more than 50% improvement is about 80% of the people that we treat. Very good for chronic tendinopathies in the shoulder, whether it's rotator cuff or otherwise. And then for your general osteoarthritis, or whether it's in the actual shoulder joint or other smaller joints around the shoulder, again, greater than 50% improvement in 80% of the people that do it. So very high positive responses. This is a good study that was done about 5 months after a stem cell procedure. You can see on the on the left, this is the before picture. So this is sort of the ball and socket joint of the shoulder here. This is the arm bone coming up and attaching to the socket. This is where the rotator cuff comes across, and you can see this big white area with a big red arrow, which makes it a little obvious, is a rotator cuff tear. And you can see the fluid from the joint starts to track up above the tear, and that's how we know that it's a complete tear issue. On the right side, this is 5 months post-treatment. You can see the rotator cuff has completely regenerated around the ball, and it's reattached. And this patient did obviously very, very well. And that's a real case. So there is proof, imaging proof, that this does, regenerate these tissues. For hips, osteoarthritis, the research that the Regenexx group has done that says that most of the outcomes are more favorable with people under the age of 55. That's not very realistic. I can't say that I've seen too many end-stage or advanced hip arthroses in a person that's under the age of 55. So really, we're seeing that the patients, even into the advanced age categories, are still having good outcomes depending on the presentation. And we're seeing that the outcomes really aren't affected by whether you're male or female or how much you weigh. It's about 60 to 70% improvement overall, depending on how the joint sort of tracks and the amount of arthritis that's there. The things that will reduce the outcome pretty significantly, if there's very severe arthritis in older patient populations, and what I found the bigger issue is that if there's a loss of the range of motion, if the hip is starting to contract, if the joint isn't moving the way that it should normally, that will really, I feel like, reduce the outcome very much. And that drops it into about the 33% outcome. So that's something that we're trying to work on. We're trying to work ways around that to help patients get better responses. And there are some things that we're doing now that I found that have been much more helpful for people that have these issues. And I've actually had some very positive responses even with this. Avascular necrosis. This is a process where the blood supply to the bone actually starts to die off, and the bone starts to deteriorate. It's a very hard problem to treat. Normally, patients end up going through a total hip replacement just because of the process itself. With this, we are having favorable outcomes where we're actually drilling into the bone, similar to what actual orthopedic surgeons do, and basically into the area where the bone starts to break down here, and then injecting the stem cells into that area of breakdown. For cases where the necrosis is mild to moderate, we're getting very favorable results. More severe changes where the bone actually starts to reconfigure and change shape, that's where we're not getting very good responses. So that's more of something that we... The case study with a 30-year-old female with a 21-year history of knee pain, 4 different surgeries, diagnosed with arthritis in her 20s, developed this avascular necrosis in 2012 on crutches, underwent the Regenex procedure in March of 2015, and basically had significant pain reduction and basically is overall back to normal. But you can see here, this is that area of bone breakdown, and as you know, following the treatment, you can see even into September of 2015, definite changes in that in the appearance, and then even reduction more of the bone marrow swelling, and there's some definite, you can see some, it's hard to see from back there, but there's a lot of cragginess in the cartilage here, and then here it looks much darker, it looks much more well formed. So definite progress. In just a little over a year after the procedure. Stem cells versus joint replacement. I think this figure speaks for itself. 73% of the hip patients return to their sporting activities after the procedure. So guys that come in and they say, hey, I just want to get back on the golf course. 73 to 75% chance that that's going to happen. So, I'd say that's a very positive potential. So, with osteoarthritis, with the knee, very, very, very favorable outcomes with this, even in advanced stage, end stage osteoarthritis. Surgeon tells you bone on bone, doesn't really bother me all that much. We're having about, I think 66%, maybe even on the low end, but I'd say that's probably where the bell curve peaks. Again, age, weight, not a factor. Women, for some reason, tend to do a little bit better than men, so ladies, congratulations, but we don't really know why. ACL tears, ligament tears, even up to a 1 centimeter separation, we're finding favorable outcomes with this. So for athletes that are developing acute ACL tears, this treatment's been very good. I've found it very effective for people that have advanced arthritis or developing arthritis, where the ACL starts to get stretched, strained. You can see it on the MRI. It kind of looks like a rubber band that's been just taunted for over and over and over again. You do it, and that sort of nice solid appearance comes back, and it looks very good. Meniscus tears without sort of these mechanical catching, locking, or sort of give way weakness, about 90% improvement with that. So that's been a very, very positive outcome. This is a 58-year-old aerobics instructor, 4 years of right knee pain, and grade 4 chondrosis of the medial compartment. That's end stage. That's bone on bone. So here you can see the outside compartment of her knee, very good, nice, black-looking cartilage. Here it just looks white. There's no black there. There's almost no cartilage that's left. She received the SD treatment to the knee, ended up returning to full-duty work, instructing, doing whatever she wanted to do within 3 months. 1 out of 10 pain, 85 to 90% improved. And you can see here a lot of difference in the joint gapping here. And there's definite, you can see there's a difference here and here. I know it's hard to see in the back between the amount of space and then sort of some of that blackening and thickening of the cartilage. So she had very, very positive outcome. And again, you can see graded as grade 4 back in October 2013, and then grade 3 by the time June of 2014 came around. So the Regenex procedures performed in 2012, the mean age of 58, so that was sort of the average patient age, and the BMI was about 27.7, which is right in the realm of normal. 43 patients were available for scoring at 3 months and 23 at 1 year. There were 70 total knee replacement patients, and 19 were available for follow-up. So you can see the knee replacement before function score, there's a much higher rise in the functional score between the after from Regenex and from the knee replacement. And then the assessment you can see is definitely sort of the same response in the Regenex procedure. So that, I think, they're definitely good outcomes between the two. 1,000 patients, 2 out of 3 reported that at least 50% of improvement at 6 months post-procedure. So if you look at the outcome measures, most of the healing process on the sort of infographic scales comes between about the 3rd and 6th month. So that's where the biggest upswing usually occurs. That doesn't stop there. So, I've had people come in early on, maybe after a month. They say they're feeling much better. But that's sort of variable. Some people come back and say, I'm about 20% better. I have a little more ease doing some things, but I still have some work to do. But if you look at the outcomes down the road, and our data only goes out to about 5 to 6 years right now, but even at the 4-year mark, people were still seeing improvements. So that 50 to 60% improvement goes up even to 80 to 90% by the time 4 years rolls around, and that seems to be sustained. So, but beyond that, we don't really know. The data only goes out so far. So a lot of the big questions are, how long does this procedure last? And I really don't know, but we are seeing sustained results with it. Spine care. Unlike some of the other clinics, we inject everything in the spine. So whether it's the epidural space, the facet joints, the ligaments between each of the vertebral bodies, or the disc itself, we have different types of procedures that address all of those different things. Safety record, this is sort of a big question with a lot of people. Like I said, the downtime is very minimal, 1 to 3 days. Usually the average is about 2 to 3 non-weight bearing after most of these procedures. Very low risk for complications. Like I said, we're not opening anything up, we're not cutting into stuff, we're not sewing stuff. It's just a couple needle injections and that's about it. We use guidance, so anytime I put a needle into somebody, I want to know where it's going. I don't just want to do it blindly, so I'm not just poking around on you and hoping that I get it where I need it. We're either using ultrasound or we're using fluoroscopy, so anything that we do, we want to make sure that we do it right. 0% infection rate, so nothing at all. Short-term pain, I mean, you're dealing with probably anywhere between a couple days to maybe a couple weeks worth of discomfort, and that usually tapers off, so you're not dealing with this ongoing need for recovery, need for pain medications, limited activity, and people tend to do very well. And all this comes from a very recent publication that involved over 2,000 patients, so this is something that's been studied in multiple cases. So this is sort of the big question with a lot of people is, what do you come to expect when we're actually doing these stem cell procedures? So The stem cell procedure is actually, it consists of 3 different treatments. So there's 3 different appointments that you're going to attend, usually over about a 7-day period. The first appointment is when we administer prolotherapy. So that helps to stabilize a lot of the structures in the joint that we're addressing. And it also helps to sort of initiate that early inflammatory response that you want the stem cells to go into, because that's sort of where they thrive. That's their home environment. One of my partners actually uses the analogy of tilling the soil before you plant a garden. So that seems to reign true. The second treatment, when you come back after that prolotherapy, the prolotherapy treatment, when you walk out of there that day, you'll be weight bearing as tolerated. So you have no restrictions really after that procedure. When you come back, that's when we give you the stem cells, and the first part of the day is the actual stem cell extraction. We'll talk about that. The second part of the day is the stem cell re-injection, and we'll talk about that too. And you get platelets along with the stem cells. Platelets, as my partner says in the farming analogy, is they're like Miracle Grow for stem cells. So they help to spur the stem cell response, and they help to sort of train or teach the stem cells what they're supposed to do and where they're supposed to go. And then, so after that stem cell re-injection, we usually keep people non-weight bearing on that limb for about 2 days, or we try to restrict the movement in that joint as much as possible for those 2 days, just to protect everything that we did. And that just helps to sort of let the stem cells sort of settle in. And then you come back for the third appointment. That would be another platelet injection. Once that's done, you'll probably walk out of there that day with some sort of bracing or something that will not limit your activity quite as much. The stem cells are actually harvested from an area on the back side of the hip bone, pretty much right here. It's not actually in the hip joint. It's not in the spine. The only thing that really attaches to that area is your butt muscle. So there's no major nerves, there's no major blood vessels. It's basically just soft tissue, muscle, and bone. And so I know a lot of people have concerns about prior total hip replacements or other spine surgeries that may limit them. That's not a factor. So we don't have to worry about that. That's okay. So how do we actually enhance this this stem cell response? We do a couple different things to help this create a good environment for these stem cells to actually do their job. One of the things is bracing. We try to de-stress the joint as much as we possibly can. So for knees, if it's an offloading brace or whatever it may be, that's very helpful. Appropriate nutrition. The body has to have the correct fuel to be able to run correctly. You don't put, 87 gas in a Ferrari. So, if you want your body to run at its optimum, you got to give it the optimum. So we try to counsel patients a little bit on optimizing some of the nutrition. If you're diabetic, try to get the blood sugars as well controlled as we can before. Try to get the cholesterol down as much as we possibly can before. Cut out the tobacco use, cut out alcohol, and that usually gives the body sort of its kickstart to back into working order. There are some medication restrictions that come across with these procedures. Particular things are anti-inflammatories have to be off for several weeks and then 2 months after. Things like certain blood pressure medications, statins for cholesterol control. And the nice thing is that, I usually try to stay in touch with people's PCPs and work with them to try to optimize that. So, if a patient has out of control cholesterol, try to get them on the appropriate diet, get that under control first, and then we can get the medications off and work from there. Is that an absolute restriction? No. There are still medications that we've been a little bit lenient with some people, but the caveat to that is that, it may inhibit some of that response from the stem cells. So again, you got to be totally optimized and in good working order for your body to respond appropriately. So supplements are a good thing. We have some of our own supplements that are available through the REGENX network we can talk about. And then a lot of other people were just on vitamin supplements, multivitamins, glucosamine, all these other sorts of things, which are fine. Certain supplements we like people not to take, but we can sort of talk about that. That's on a case-by-case basis. So, and then activity modification. So, you know, some people I've had who are very high-level athletes, so it's very difficult for them to get these procedures and then not do what they want to do. That's sort of one end of the spectrum. The other end of the spectrum is trying to get people to do more. We try to meet everybody in the middle. I usually have people run through a course of physical therapy in some capacity after these procedures just to optimize strength, get back to a good range of motion, get back in working order, and sort of move forward from there. Advanced Stem Cell Support Formula. This is our Regenexx Liquid Stem Cell Support Supplement. It contains lots of different good stuff, vitamins, glucosamine, curcumin, black pepper, several other things. I'll warn you ahead of time, it tastes like crap, but it's good. It's about $100 a month for a bottle. A bottle, like I said, lasts about a month. But when you look at the ingredients, you know, for most people that are taking all these supplements in isolation, you're paying probably more for the individual supplements than you are for the formula. I usually recommend this. It's a recommendation after the procedures, just to, again, basically optimize that body's healing potential and get you back to good working order. One thing that you yourself can take a look at is the book called Orthopedics 2.0. It's available in several different formats. You can get it directly off of the Regenexx website. It's free. It's a little bit of a longer read, but it's mostly pictures, so don't get overwhelmed because there's a lot of pages. But now it's in the 3rd edition because, like I said, they're constantly, you know, revamping these procedures, optimizing things, and so I think that really speaks for itself. That's great. A lot of people want this. You know, it's been downloaded quite a bit, a lot of copies out there in print, so it's very highly sought after. So, lucky for us, the young lady that I talked about earlier in the talk is Julie Cerrone. She's here with us tonight. So she's going to share a little bit about her story and her experience with Regenexx, and I'll let Julie take over.
Hello. I wanted to show you a little video of my journey. But before that, give you a little background. My name is Julie. I live in Bethel Park. I'm 30 years old. And I've had a lot of health issues. A lot. In my 30 short years. And it started with a knee surgery that I had in 5th grade. And since then, I've had 5 knee surgeries, 4 on one on the other. I can't even tell you how many times I've been in therapy because it's countless. Braces, crutches, you name it, steroid shots, nerve blocks, all of it, done it. And I used to think that surgery was really the only way. I was officially diagnosed with psoriatic arthritis when I was 27, but if I was a betting woman, I would guess that it started when I was in 5th grade when I had that first knee surgery. And I started having a lot of pain, came to realize that part of my femur bone had died. And it was a journey to try to figure out an answer to that. So on that note, I'll switch over to this little video. The first time I heard I had avascular necrosis, my doctor said, you'll probably need a knee replacement. They last about 15 years and you can get 2 knee replacements in your life. And I'm doing the math and I'm thinking, hello, I'm gonna be like 60 and what am I gonna do? I'm not gonna be able to walk. When I would go to doctors and they would talk about a knee replacement, it was very dismissed because I have autoimmune issues, my knee was super swollen, my body was just fighting itself, no one wanted to give it to me. It was Christmas time in 2012. I will always remember my doctor's face when he came in. He said, your bone is dead, it's called avascular necrosis, I know what it is, I've seen it, but I have no idea how to treat it, and really he had no one to send me to. You know, I'm a pretty positive person, but after, the 15th doctor is telling you that they can't help you or they don't know what to do with you because you have all these other issues going on, it really starts to wear on you. Life was really, really hard. I was living this go lifestyle, and to go from that to laying in bed in your parents' basement where everyone else is just, living life. I was in constant pain. I was so inflamed. It was really hard. And I was just trying so hard because I wanted to make it to Christmas and I wanted to enjoy Christmas, and I actually was doped up on painkillers most of that Christmas day and ended up in the hospital that night. So the following year, I was on crutches and everyone was like, oh, maybe you should put lights on your crutches since you love Christmas so much. And I said, well, if I'm on them next year, maybe I'll do it. Thinking in the back of my mind, there's no way I'll be on them next year. Well, the next year rolls around and I'm still on crutches. The one thing that really helped me was just connecting with other patients online through social media, through other people's blogs, to realize that I wasn't alone. That was really the driving force behind me realizing that I needed to take what I was going through and use it for good. I started a blog to get my story out there to help other people, just to get information flowing, putting out blog posts like twice a week, and I'm writing for these different online publications like WebMD, Health Central, Healthline, teaching health and wellness classes, with going and speaking at conferences and representing the patient voice. When I started finding information about PRP and stem cells, I had gone to a few doctors who suggested one or the other, but it never just really felt right until I came across the Regenexx procedure. Last year I said, this is it. This is the last Christmas I'm going to be on crutches. So I'm doing up big, I'm putting the lights on the crutches, because I knew this time last year, I knew I wasn't going to be on crutches for Christmas because I had scheduled my Regenexx procedure. I just knew it was going to work. They were the first people that gave me hope. I knew stem cells, they were my own stem cells. My body wasn't going to fight it. So this Christmas is really special because it's the first one in 3-4 Christmases that I'm not on crutches, and I'm able to walk. And you don't really think about walking and Christmas together, but it's so special to me. I'll be able to talk after that. I can't watch that without tearing up. Because honestly, it's so corny that I'm getting all teary in front of you. I'm sorry. I went to so many doctors, and I would beg for someone to give me a knee replacement, and no one would give it. Best thing I ever did my knees. And I used to honestly think that, knee replacements, so many people get them. And even when I was in high school, they used to say, oh, by the time you're 30, you're going to need a knee replacement. You may be 16, but you have the needs of a 70-year-old now. And I just always had in my mind that I would need this knee replacement. And the procedures that they're doing here are life-changing. I mean, I spent almost 4 years on crutches, and today I'm in front of you in wedge heels. And maybe your goal isn't to be in wedge heels, talking to a group of people, but it's been such a life-changing experience for me that I feel like I need to give back and be there to answer questions for people and to tell them that you have options. And if I could give you one piece of advice, it would just be your best advocate. There are many different options out there for you. Don't just go with what one doctor is telling you. Get options. I started a blog, it's justabadday.com, after It's Just a Bad Day, Not a Bad Life, because we all have bad days. But I've blogged every single part of the procedure, every month since, how I'm doing, how things are going in my bones. So if you are interested in these procedures and you want a patient view, I did this all on my own, just trying to get the information out there for people. So I would urge you to check it out. And I'm here if you want to ask questions. I actually wish I would have been able to go to a seminar before I had it done. because I think it's so beneficial to talk to somebody who has had it done, because I mean, there's not a ton of, I mean, there are a bunch of us out there, but it's not as common as it should be. So I'm here. Please ask me any questions that you want to. And like I said, do your research and make sure that you pick the best solution for you.
Thanks, Julie. And like Julie said, this is not as common as it should be. She's one success story of, you know, I see people every day that come into the office and they feel great after these procedures, and it is very rewarding to be able to give this to people. You know, if you ever do want to talk to somebody that's sort of been through it and lived it, we do have some patients who have been gracious enough to give us their contact information and say, hey, if you ever have anybody that has questions about this, have them call me, because I'll tell them exactly what I went through and how this helped me. So if you want that information, that is available. We'd be glad to give it to you. In summary, you know, the summary of the procedures, at least, we talked about sort of everything, walked through very briefly on the stem cell procedure, but sort of gave you an idea of the timeline that follows and how we administer it. So what do you want to look for in a clinic when you're actually seeking out these kinds of treatments? All the doctors that we have in the REGENXX network and in our clinic, we're all musculoskeletal experts. We've done fellowship training. We've been doing this for a long time, and we all do these procedures, you know, in the same way, very much so. There's a protocol that's been used. We've done this in our clinic, hundreds, nationwide, thousands. So it's proven to work. Imaging guidance, like I said, whether it's ultrasound or fluoroscopy, we're knowing exactly where we're putting this stuff. And imaging guidance to place cells. So we not only use the guidance to put the cells in, we also use it to take them out. So it's not just haphazard. The specific outcome research on the specific protocol. So we've actually researched how we do this over and over again to make sure that this is the way that actually works. And if it doesn't work, like I said, even with the hips, we're looking at new ways to give people better outcomes. So it's constantly evolving. And constantly innovating. Like I just said, we want to do things better. So we're always looking to do things right and more effectively. Collecting and publishing data. Like I said, the REGENXX network puts together most of the research that's involved with these stem cell procedures. So they're taking a very close look at it. Like I said, then the research that comes out. When should you run? Any sort of any treatment option that they're giving you that treats every AD disease. I mean, we're talking about everything from you know, rheumatologic diseases or autoimmune diseases or cancers or all these other things. I mean, if we were a musculoskeletal clinic and we were claiming to sort of treat all those issues, I would take, you know, that would sort of send up a red flag. Anywhere that's promising extremely high success rates that seem too good to be true. I mean, we're going to be honest about how we feel like these treatments are going to be effective for you. If like I said, you know, you're a person that comes in, you have really bad hip arthritis, you know, you have really end-stage disease, the hip doesn't work the way that it should, I'm going to be open and honest with you about how effective I think the treatment can be and what we can do. So individual consultation definitely has an effect on, you know, how we sort of approach each patient. But if they're telling you right from the door, hey, we're going to get you 100% better, no questions asked, I mean, that's something that I would say is probably not accurate. Long on success stories, short on data. We have the data that backs up everything that we talk about in these procedures. So it's not like we've just done one or two patients and we say, oh yeah, this gives patients 60 to 70% relief. This is thousands of patients that we've looked at over years of data. Any doctor that claims that they took a stem cell fellowship from the A4M. The A4M is more of like a functional medicine course, so it's not a stem cell fellowship. when we talk about fellowship training, we're talking about more specific musculoskeletal or pain-related fellowship treatments. I'm personally sports medicine certified, and my partners are both pain certified, so we've gone through extra training beyond residency, beyond medical school, so we have years to back up what we do. Like I said, not a weekend course. The physician who's actually giving the procedure is not an MD or a DO. There are some other practitioners out there who claim to be doing these procedures. If it's not somebody that's been medically trained or gone through a medical fellowship specialty, I would take a little bit of caution with that. The clinic just opened, but it already claims to have treated thousands of patients. That's obviously a red flag. If they just opened their doors a couple months ago and they're already saying that this works for everybody, that's something that I think you should be a little bit wary about. So are you a candidate? I think everybody in this room, you're here interested in this, you probably have this question in the back of your head. The best way for us to know is for you to come in and see us. I see all your faces out here in the crowd. I've treated you all look like good patients to me, so but it's hard for me to tell if I don't see and sort of put hands on you. So it's nice for us to look at imaging. So if you bring any imaging into the visits, anything that you've had before, anything that we can use to sort of track your progress, that's also very helpful. We do comprehensive evaluations, so it's a comprehensive exam. We sit down and take your history. We talk about the different options. We talk about how we're going to administer this procedure and what we think would be the best for you. And each patient, like I said, is given the treatment plan that we feel is the best for them. It's not a one-size-fits-all deal. I can't say that it's very rare that I give the same treatment over and over and over again. Everybody gets something usually a little bit different. So the insurance coverage issue, the financial issues, what does insurance cover? Insurance covers any visits that you have with me face-to-face, any of the follow-up visits, like I said, any of the diagnostics. So if we need to get new MRIs, if we need to get blood work, any other testing that we might need, or any of the bracing, whether it's knee braces, slings, crutches, walkers, anything like that, whatever it might be. What the insurance does not cover, basically the three procedures that we talked about, the prolotherapy, the platelet-rich plasma, and the stem cells. Anything outside of that they will cover, but those procedures are not. And like I said, it's a very variable sort of treatment plan, so the prices are all over the map, $300 to $7,500. So that's not sort of the closed window. I mean, that's just sort of what we usually see. Is that going to be the cost that you're going to incur? It's not always the case. It just depends on what we're seeing you for. So, closing remarks for this. Basically, like I said, these are cutting-edge treatment options. This is something that you're not going to see a lot of places. We're one of a very few provider networks, provider clinics in the country that offer the REGENXT procedure. So, it's something that is, I think, going to become more common. But right now, this is sort of the new treatment that I think is going to be the best for a lot of people. Little to no downtime, like I said, a couple days, maybe a week. That's usually what we're looking at for people. You're avoiding surgery. Like I said, no big cuts, no metal, no sutures, no screws, no rods, no plates. And it's safe. Like I said, no infections. We're only using a couple needles, and really no residual pain from any of the other extractions or anything that we're doing. So the conclusion, REGENXT is not magic stem cells. This isn't something that we're just pulling out and putting back in and crossing our fingers. These are very well thought out procedures. We address things in the way that we think will restabilize the body's structure, re-heal tissue, and basically reorganize your makeup. And that's where the quote-unquote magic, I think, happens. It's advanced and precise interventional orthopedics. It's like I said, we know exactly where we want to go, and we're going to get there. we've been doing this longer than anybody in the U.S. Like I said, they've been doing this since 2005. It's not been tracked really since 2005, but that's really when it started. More published online registry data than anyone else. They spend more of the resources than anyone else tracking the data, developing new research, adding to the lab component, and we have more treatment options than anybody else. So it's not, like I said, a one-size-fits-all deal. We have various ways that we can address this for all different types of patients. Going back to the locations, like I said, we have 4 locations around the Pittsburgh area. 1 contact number. If you'd like to get a hold of us to set up a consultation, you can pick the office that's closest to you. It doesn't have to be anyone in particular. I am mostly located at the Pittsburgh Fox Chapel office, Monroeville, and Bridgeville. I don't go to Sewickley. So if you go out there, you'd see my partner, Mark Adelsheimer. So some additional upcoming seminars. You're here today, so thank you for coming. Tuesday, August 23rd, will be in Moon. And then Monday, August 29th, will be in McCandless at the Northland Public Library as well. So if you would like a repeat performance, you're more than welcome. All right. So I'll open the floor up to questions. So anything and everything, you guys are welcome to fire away. Yes, ma'am.
FDA approved.
So, okay, that's a good question. There's a big difference between FDA approval and FDA recognition. So I want to kind of be clear about this. FDA approval is where you'll get the stamp on it, right? So that involves 10 years of clinical-based trialing, plus actual patient, administration and that sort of thing. And then the FDA says, okay, you've put out this many studies, you've done this many treatments, here's your stamp. The other caveat to that is that there's FDA recognition. So basically there's a certain set of standards that the FDA puts in place for certain types of procedures, such as biologic procedures. They say that if you're taking a biologic product, such as blood or other tissue, if you're just doing minimal manipulation to the actual product and administering back to the patient, that is fine. They start to get up in arms when you do things like taking enzymes and extracting. So like for some of these fat procedures, and the reason this has come under a lot of scrutiny is practitioners have been adding enzymes to try to extract stem cells from the actual fat product rather than just inherently injecting the fat product. The FDA says, well, now you've created a drug, so this is now against our standards. So the only thing that we're doing is we're taking the product, we're spinning it, we're separating it, we're spinning it again, and we're giving it back to you. So that's what is considered minimal manipulation. When we started this procedure back in 2005, Chris Centeno, who's sort of he sort of developed this procedure, he said, well, let's take these stem cells and let's culture them out on Petri dishes so we can get zillions rather than just millions. And the FDA stepped in and they said, no, you can't do that. Now it's a drug. So you can't do that. So he said, okay, well, we'll take that down to the Cayman Islands. So that became Regenexx Cayman. So that's what they do there. They basically do the same procedures, but they culture the cells for a little while so they get more product, which the FDA says that's fine. You can do that there. So really, the FDA says as long as you're only doing these certain things to the product, then that's fine with us. So there hasn't been any controversy since that point. So that's why I always try to separate the definition for people. So just so you know that the FDA doesn't say, oh, well, you can't do that. That's not the case at all.
Why are the insurance companies not covering?
Another good common question. She asked why the insurance companies usually don't cover these procedures. It's kind of a loaded question. The basic answer that I can give is that insurance companies look at hard data. Now, most of the data that we have is more patient-based, subjective outcome measures. So we ask patients, how do you feel? How are you functioning? What are you doing? And we rely on patients to sort of give us that feedback. When you're looking at insurance companies, they like what we consider Class A randomized placebo-based trials. That's where you're taking a certain product, comparing it to another control or a placebo, and then trying to, see how it compares. When you're actively drilling into somebody's bone to extract this product, a lot of these governing bodies that oversee these studies say, well, you can't do this harm to this person and take out this product and then not give them something back. So there's red flags that go up with that. So that puts a lot of limitations on how and it's hard to sham doing that kind of procedure for somebody. So it's hard to develop a good study to really compare these to a control or to a placebo to give us the data that the insurance companies need. Now, that may come along down the line. I know in Chicago, one of the Regenxx clinic is doing some research with knees and comparing them to corticosteroid injections, so just comparing them against different treatment arms. So we're trying to get some more objective data in that respect. So in the next couple of years, I don't know, that we may see a shift in how this is seen by the insurance companies, but I don't know when that will happen. But that's sort of the basic answer for that. It's just a need for additional data and that sort of comparison. But I think it's going to happen. Okay.
How painful is the procedure?
I hope not painful at all.
Not painful to
It doesn't hurt me a bit, right? I've asked patients sort of across the board. Anytime I treat somebody, I try to get feedback on how they feel and what they're experiencing. For the most part, we use a lot of lidocaine whenever we're addressing the soft tissues before we even start this procedure. So anything that I'm doing above the bone, normally patients don't have any discomfort with that. When we actually get to the level of the bone, when we're going into that, when we're breaching the bone, normally what people say is they feel sort of a deep pinching sensation. That resolves very quickly. Patients usually say the greater discomfort comes in when we're actually extracting the marrow. And they say that feels sort of like a deep abdominal pressure. It's kind of hard for them to describe. But they say, once we stop, it goes away and everything's fine. And they say, about 6 to 9 seconds at each site. So it's a total of about a little over 30 to 40 seconds of pain, discomfort, and that's pretty much it. The procedure for the extraction only takes me about 10 minutes to do. So it's quick, it's not belabored, 2 little bandages on the skin and then it's done. The injections, the re-injections are really, not painful at all. For people that have had, and I don't know how many, I'm sure a lot of people in here have had injections into your knees or hips or back. It's basically that. I mean, maybe even a little less discomfort. So that's really what the comparison could be for the re-injection.
I can speak to it personally.
Yes,
I know.
Julie can totally.
I would say that when I had the bone marrow extract, my parents were actually in the room, and I was talking to them basically the whole time I had it done. I mean, it was uncomfortable, and it's achiness is a really good way to describe it. It's kind of how it felt. It was just very achy, and then after the fact, it didn't really bother me too much. And then with the re-injection, with just injecting the stem cells, I mean, it was just like getting a shot. There were a few spots where I was like, ow, 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 ow. It was a little tender, but nothing like having a knee surgery or anything like that. The night after I had my stem cells, my knee swelled up a bit, and that's common because you're bringing all those inflammatory cells into the area to heal it. So I think that was probably the worst part. It was just a couple days with my knee kind of swollen, but honestly, having had 5 knee surgeries, it was so easy. Piece of cake. Thank you.
You're welcome. Yes, sir.
If somebody's had injections of steroid and you flex it in the past,
Yes.
is there a restriction to having the stem cell?
Great question. The question was if you've had steroid injections or hyaluronic acid injections, Synvisc or the like, are there any restrictions? The only restriction would be that we have to wait about 6 weeks after any corticosteroid injections before we can administer any stem cell injections. That gives time for the steroid to clear, and we definitely don't want people on steroids or getting steroid injections after the stem cell procedures because that will really shut down that inflammatory response, and that's not what we want, obviously. The Synvisc, that's not really a restriction at all for the most part. So there's actually been a little bit of research that has been more in the Regenex system now of, does the Synvisc actually help this to some degree? So that's still early in the early phases, but that doesn't really put a damper on what we can do at all. It certainly doesn't preclude you from getting this. Right. Yeah. No, absolutely not. Yeah. Anybody else? Yes, sir.
How many of these procedures have you personally?
Have I personally done? You know,
When did you have to start your first one?
That's a great question. I've been doing this since March of last year, so I'm about a year and a half into it. I was the sports medicine director at Washington Hospital before this, and I did some PRP in my office I had the bedside centrifuge and doing that sort of thing. And once I heard about this, I got on board with these guys, and it's been great. The amount of procedures that I've done, I don't know. I haven't tracked it. We do probably anywhere between, when I started, it was maybe 10 to 20 procedures a month, sort of split between all of us, and now it's ramped up to, you know, I think we're in the 30s per month now. So it's, you know, we're doing a ton of these all the time. So I'd say in the hundreds for sure. Yeah. Yes, ma'am.
How about reactions to this treatment?
Reactions? As far as, no, well, no, not in the sense of like allergies and things like that. No, because it's your own stuff. So, you know, you can't react negatively to it. Your body just accepts it as its own. So allergic type stuff, no. Reactions like Julie was talking about, there's usually definitely some inflammation after the fact. So I've had a lot of patients, and I warn patients about that, and that's why we usually have people non-weight bearing after the procedure, because you do get swelling. I've had people call in, they have a lot of redness, they have a lot of swelling, they're worried that it's infected, they're worried that they have some sort of blood clot or something like that. That's usually not the case. Like I said, we've never had any infections. I think we've only had two blood clot problems with people that have had histories. You know, there's not an issue with that. But that is the reaction that I think is the most common, is that inflammation definitely builds up and causes pain, for sure.
Is there any redo of the procedures, or we do it once and then maybe 8 months later you say, well, we need to do this again?
Oh, are you saying, is that a common thing?
Well, no.
Does it happen? I mean, I don't know. There's nobody that I've done that has required a repeat procedure. I had one guy, he was a sort of a very high-level competitive soccer player, and he wanted these done every year. He thought it helped him to play better, so we said, well, I don't think you really need it, but if you want it, we can do it.
But most people aren't getting them.
Most people aren't getting them again. No, I mean, you know, most of the people that I'm doing, especially not within 8 months, and I can't think of anybody that I've had to redo. I have had one woman who came back. She was having a little bit more pain. I did another platelet injection on her, and she did fantastic. So that's really only a few examples that I can think of with that. Yes, sir.
That price, basically the estimate, that's for one joint.
Yeah.
Like if you got two bad knees,
Yeah, and there's some variability, and we can sort of talk about that depending on what we're going to treat and how we're going to treat it. For one joint, like we'll say if it's a knee, that's about $5,900. That's the average price for that. So yeah. So that's the basic breakdown that I can give as far as that goes. Yeah. Mm-hmm. Yep. Yes, ma'am. I did my medical training at the Virginia College of Osteopathic Medicine. This procedure, I trained at University of Pittsburgh. So I did my residency in physical medicine and rehab through the University of Pittsburgh. My fellowship was sports and spine medicine through UPMC. And then I did my training in Colorado for the actual Regenex procedure. Yeah, so I'll tell you this. There's very little difference in this procedure from what we as sports medicine and pain physicians do on a regular basis. So I'm trained very highly in all different types of joint injections, ultrasound guidance, musculoskeletal treatment, all these types of things. Yeah, basically we take that knowledge and we sort of apply this to that specific sort of skill set. So, yes.
Have you ever done 2 injections with 1 extraction of bone marrow?
Yes.
Have 2 bad knees or something? Can you
So with that, the only thing that I worry about when I'm talking about doing more than 1 injection on somebody, if let's say we're doing 2 knees, whenever we're doing that, I obviously have to make the patient non-weight bearing after the procedure. So for 2 days, I'm taking away both of your legs basically. So you're kind of wheelchair bound. So that's the first thing that I don't like to do. If it's maybe like a knee and a hip on the same side, that sometimes is a little easier because then I'm just taking away 1 leg. The other caveat to that is that when I extract the bone marrow, I take a certain volume out, and then I send that to the lab. The volume that comes back is variable patient to patient. Sometimes I'll get liters of fluid back. Sometimes I'll get 10 to 12. It's never the same. So if I get 3 and I'm trying to do 2 hips or 2 different joints, big joints, that may not be enough to cover both of those joints. So that's where we get a little bit wary about that kind of treatment. Now, if it's a knee, then that might you get away with, depending on the volume that we get back. But I don't like to rob Peter to pay Paul with that kind of treatment. So I'd rather focus on the joint, get and sort of move on if we need to.
And the regenerative bone marrow to fat cell extractions?
No, the only time that we use fat cells is where we actually do a treatment for, and it's mostly for knees. People that have large amounts of breakdown but still have meniscus tissue, sometimes that meniscus tissue will get squeezed out, almost like it's popping out of the side of the joint. So what we do is we actually extract the fat cells and inject those back around that meniscus to kind of act like a bolster to push that back in. Plus there is inherent stem cell content in fat cells, so that adds not only the bolstering, but it adds some additional healing effect. But that's really the only time that we extract any fat cells and use that. So
when you extract the stem cells, you're actually sending those to the Cayman Islands?
No. I don't want to confuse you with that. No. The stem cells never leave the lab, or they never leave the office. They're in our facility the whole time. Yeah. And it's all the same day, so it all happens within about 2 or 3 hours. So it's not like you're going to sleep and then coming back. It's all the same time. Yes, ma'am.
Correctly, did you say that there are 33 practitioners that do this?
Yes. Yeah, and that's nationwide. Yeah. So here in Pittsburgh there are 3, myself and my 2 partners. I think the next closest clinic is Cincinnati, I believe, and then there used to be one in Philly that closed down, and I think the next one as far south is D.C., maybe even Emory, I think, is the next one down in Atlanta. So, yes, ma'am.
In lieu of any longitudinal study or research studies,
Okay.
the concern seems to be what effect will the stem cell replanting have upon the body? So if we take a stem cell from my hip
Yeah.
and you place it in my ankle,
Yes.
15 or 20 years from now, will I have side effects just as the other procedures have had? And that hasn't been documented.
Right.
It hasn't been given.
That's a good question. What we've kind of seen is that the stem cells usually only remain mitotic, or they only continue to divide for about 2 months. So you continue to get effect from that regrowth, but the stem cell only tends to differentiate for that finite amount of time. So, and then whatever a stem cell comes into contact with, that's what it sort of adapts to. So if it comes into contact with cartilage, it becomes cartilage. So the specific stem cells that we look for are mesenchymal stem cells, which are what become bone, tendon, muscle, vasculature, synovial fluid, that kind of thing. So that's where the differentiation becomes more isolated whenever you're treating just general musculoskeletal disorders. So, but to speak 15 years down the road, no, we don't know the answer to that. Is it likely? No. So
So the comparison of knee replacement now and then another one in 15 years, and another one in another 15 years, is the example is not necessarily what would be happening in a stem cell as far as you know.
as far as I know,
Okay.
right.
But it might be as a factor.
Yeah, there's no way for me to answer that question. Yeah. I mean, the only thing I can say is that these treatments seem to be sustained. So how long they're sustained, it's really a difficult question to answer. Anecdotally, if you ask the guys in Colorado, they don't really know either because nobody's been tracking it. So it's kind of hard because if patients feel better, they don't come back. So, you kind of lose that follow-up. So, we don't know.
If someone has a partial knee replacement, can they have this done?
Partial knee replacements, I usually say no. The reason being is that any metal that's in a joint is a lightning rod for bacteria. So if you're introducing anything into that, you run a really high risk of developing some complications with it. So, and I went back and forth. I presented that to sort of the network last year. I had a patient who had a partial knee replacement and was dead set on having this treatment, and everybody said, don't put a needle in it. Just don't do it. So, that's I guess the short answer. Yeah. Yes, ma'am.
Another question. In the
Yeah.
beginning of your presentation,
Yeah.
you showed us how the body works and the stem cells are
Mm-hmm.
waiting to heal the body, and they're basically sent on a mission to
Mm-hmm.
do that. If we've had an injury, why aren't they coming to our rescue? And what's the difference between?
So what do you mean by an injury?
Okay, let's say pelvic fracture,
Okay.
and it does eventually heal
Mm-hmm.
to like maybe 50%
Okay.
of the person's previous health.
So a non-healing fracture is what you're sort of getting
Well,
at.
it's healed, but it didn't heal to the point where
Okay.
you're not experiencing pain. and
Okay.
everything.
Okay.
But as it's healing,
Yeah.
and those cells are going there to
Yes.
rejuvenate and
Yeah.
heal, why is it that they don't continue to do that, and we're now left with having to extract them from the bone marrow and kind of force them?
That's a good question, and I think your question is, I think there's different answers depending on what the actual pathology is. So things like degenerative arthritis, what ends up happening is that the body actually inherently is trying to fuse the joint. That's really the inherent response. It doesn't make sense, but biologically that's how our bodies have adapted, just inherently, evolutionarily, to protect the structure. So when these degenerative cascades happen, that's why you get these big bone spurs and all these kind of things that start to form, because the joint is trying to actively fuse together. What we're trying to do with the stem cells is, because the body sort of overpowers, the degenerative cascade overpowers that healing response. That's why people develop these chronic injuries, because you get inflammation, de-inflammation, inflammation, and then it becomes chronic. When we take this response and we put it back into the area, we're reversing that degenerative cascade. So we're basically just creating sort of a new environment that these stem cells work in. So you're digging out all the clay and you're replacing it with topsoil and Miracle-Gro. That's kind of that's pretty much what you're doing. But the reason those responses get cut off is, it can be a multitude of things. It could be another injury. It could be, certain medications that people are on. It can be a lack of metabolic health. Smoking is a big one. Like I said, poor nutrition, inadequate rehab. There's so many things that can go into that. So it takes certain physical things to make that body regenerate that structure, and if it doesn't happen in a certain pattern, then you may not get the response that you want. But that's why we track these things out very closely: bracing, appropriate rehab, optimized nutrition, stop smoking, stop drinking, all these kinds of things that help us to get the best outcome. So. Yes, ma'am.
Does this procedure work on soft tissue, let's say the abdominal area?
It depends on what we're treating. So things like scar tissue, we have done certain prolotherapy treatments that have been helpful for that. Yeah, absolutely. Absolutely.
And muscles?
Yeah, you know, depending on what we're treating, chronic injuries, tears, all sorts of different things that we address. Absolutely. Did you have a question?
Just a short one.
Yeah.
We're talking about the stuff,
Yeah, the supplement. Yeah.
is that an ongoing forever, or is that just until you feel as though?
That's sort of based on you. I usually recommend it for a couple months after the procedure just to keep that tissue optimization. My partner, Dr. Lieber, takes it every day. And he says, I haven't had to have a stem cell procedure yet. He's 62. So that's his sort of joke. The guys in Colorado, they drink it in their protein shakes. So, I mean, you know, it's just something that sort of, it bolsters your immunity. It helps with your cardiovascular health. It reduces inflammation. I mean, it's just good to take all around. So, you know, it's just a good supplement. That's
required to be taken just by itself, or
you can mix it in juice. Yeah, absolutely. Gatorade I found is very helpful for it. But yeah, so really, yeah, you can mix it with anything except beer or wine.
You said about the volume of stem cells that you see back.
Yeah.
Has it ever been a concern when you haven't got enough volume back to
No. Typically, I usually get over 3 milliliters, and I would get concerned if I got less than that, but I've never had that been a problem. Yeah, that's a good question, though. Anybody else? Yes?
May I have a comment?
You may.
My name is Gary Sorrell. I'm a Troll's dad. And I would like to tell you from a perspective of someone who has purchased this. My daughter 4 years ago lost a lot of her day-to-day function in her life. And it was very difficult as a parent to see her go through that. And we went to every orthopedic big name in Pittsburgh, every one, and they gave us no help. And more importantly, when we went there, they would say, we can't help you, and we don't even know where to refer you. And my daughter researched this in Genetics, and I had a lot of skepticism because, number one, the cost seemed really high. I didn't know if it was proven. I thought it could be a gimmick, and I was worried about my daughter's health. And every concern I had has been eliminated, because God is my witness. Because they gave my daughter her life back, because she was on crutches for 4 years, and we had no way of getting her off, other than a knee replacement, which no one would do. When you saw her MRI, the part that regenerated in 6 months, 50%, to where they don't believe her knee will collapse, where she would have to have her knee taken out. And she was on crutches, and she has her life back. And I can tell you that I don't know anybody here. I live in Bethel Park. I'm a normal citizen. That if you have any reservations, go talk to these guys, and at least let them give you an opinion. Because you have nothing to lose other than saying, I'm not interested. But they gave my daughter, functionally, her life back, where she is normal and walking and doesn't have crutches. And I'll end on one thing. Every dad just walked their daughter down an aisle, takes it for granted. The day I walk my daughter down an aisle, I won't, because these people have helped her more than anybody in Pittsburgh even came close to. So I implore you to just talk to them. And if you don't like it, leave. But if you don't, you may be missing an opportunity where it could help her, help you like it helped my daughter.
It's also important while shopping around stem cell options to make sure that you know exactly where your stem cells are coming from. You want your own stem cells. You want your mesenchymal stem cells. You don't want necessarily amniotic stem cells from a placenta in pre-syringe or pre-packaged syringes. You want your own stem cells. So make sure to do your research, make sure you're asking the right questions, and definitely the doctors at Rehabilitation and Pain Specialists here in Pittsburgh know exactly what they're doing.